Okay, welcome everyone. This is our first lecture as part of the social media research series, and we're looking today with the topic of Introduction to Social Media Research. I'm Dr. Faisal Nawaz, one of the GRRSP faculty, and we are here giving this session with GRRSP Batch 17. So we're going to start off with understanding social media research, examples around it, and how something like social media, which we look at in such a casual way, could actually turn into very actionable, publishable research outcomes. So we're starting off with the background. We're looking into certain types of social media research, examples, and then what are some kind of pointers you need to keep in mind in helping you decide between so many different social media research types. So I like this slide here, and it's something you may have heard of in conferences quite frequently. So data is the new oil, and this is very much relevant to the world of research. It's taken over the way we understand people, understand organizations, and even our patients. So when we're floating around so much data, it's almost a loss, I would say, if we don't use this to our benefit, and sometimes that applies to social media as well. So maybe after this lecture, you're going to be looking at that usual Instagram reel differently, because everything brings out insights for us to study. Now, these are some statistics on kind of how big each social media platform is. And uh, I'm pretty sure these statistics have already grown since the time of preparing this presentation. But Twitter, now known as X, hosts about 368 million monthly active users worldwide, and TikTok is over a billion users every month. So it tells us a lot about how social media and research around social media, the numbers are quite big, even in terms of the data that comes out. So one might perfectly design a cross-sectional study in a real world setting and get probably 1,000 responses, 5,000 responses at best, with a lot of funding resources from your study. But then you have kind of social media research that gives you millions of data points to work with. And why is it so important in healthcare? So, there have been statistics coming out around how people choose their specific doctor, hospital, or facility. About 41% do based on what they see on social media. 80% have tried searching for it, and I'm sure we can relate to that, that before we looked about any symptoms, any illnesses, we tried to search on social media about its impact. And then 60% trust social media posts by doctors over any other group of professionals. And that kind of tells me the responsibility as clinicians, as researchers that we have in sharing the right information, and not just sharing it rightly, but also quite actively. Because otherwise, it just stays within our clinics, it stays within our research publications, and chances are the patients aren't going to go on PubMed and read that paper anytime soon. So that's where social media has a value for healthcare providers. And these are some kind of pie charts looking at countries that use social media, depending on different platforms. And it could give you some direction on the topic you're choosing, because certain topics may be prevalent in certain countries more, and that could guide your choice of social media research as well. So it's not surprising about, 40% of X users and healthcare professionals on X come from the United States, and about almost 50% of the top 15 countries, just generally speaking, have healthcare professionals in the US, but other countries are also not too far behind. And they could represent a big share of the data, but it could also create a bit of bias around social media data. So it's something we have to just be very careful of when reporting data, that how diverse is the data that we're finding on social media, and who kind of make up this data point, right? We're talking so much about data. So it's going to be healthcare providers who tweet, post, make video contents. Then there's patient groups. And I think this is a very powerful source for patient groups to have a voice, communities out there. And you're going to hear the word community a lot in this presentation. Lots of policymakers, healthcare organizations. So when we went through the pandemic, we saw the role of social media in announcements from governments, from health policymakers, almost in real time, sometimes before you could even see it on a news outlet. So that could also influence people's behaviors and their response to vaccines, their response to medications, side effects. So that's the lens that health policy and public health can play. And then common folks. I mean, let's not kind of forget that a big part of social media and the interactions are mixed with people who may not understand health information. But it's interesting when we think about user sentiment. So sentiment are emotions of people. And those can actually be sometimes shifted around based on how and who is talking about it on social media. So research designs. So that's the, I think, the big part here that we're all waiting for, that how can data, people, and research come together on something that seems so dynamic like social media. So we're going to go over a few research designs that I feel are the most practical, the most kind of emerging, because social media research is one of those designs and fields that it's still finding its way around in the global research world. And we're really happy that with GRRSP, we're one of those few programs in the world that have mastered it and can actually share that knowledge with you now. So one thing to note before we talk about different designs, so just unlike traditional research where you have more fixed designs, be it observational or retrospective or case control, social media research is a bit mixed. It's a bit of everything on the pie. And you'll see that as we talk about different designs. So most of the times it's quite observational, it's quite cross-sectional, so it's in that moment, in that time. You may not get the chance to add an intervention to your social media design. You're often observing the population data rather than changing it. It could be retrospective, so it's going back in time and looking at data, and a lot of the more kind of straightforward research that you can do on social media is retrospective. But it can also be prospective, and we look into how it can be designed as something that goes into the future and then you collect that data. It could be review based as well, and then it has a bit of qualitative elements rather than just being purely quantitative. So the first one we're going to talk about is campaign focused initiative. So this is something where you have a certain topic in mind, often related to an awareness initiative around a certain disease, something that isn't represented enough. And that could be turned into a research study on social media because we've got so many campaigns that happen, and some of them are already happened. Maybe it's about mental health awareness or women's health awareness. And we could go back and look at that campaign's impact on social media users. Or it could be a campaign you design and prospectively create its impact and then study that impact. So it could be done both ways. And that's one way to look at it. Of course, the challenges with doing it prospectively is understanding that you need an influencer network to promote that campaign, to make it popular. And that can be quite challenging to do within a short timeline. But if it's done well and if it gets viral enough, then essentially the impact can be measured and turned into a research paper. So that's campaign focused. So these are some options that we're showing as examples. So on my left side, you can see that tweeting the meeting, so quantitative and qualitative activity on Twitter during a certain conference. So a conference can be seen as a campaign where you're often promoting insights, education, and then eventually gathering that data. So if you have a specific conference that you can think of in your field that is a big deal and it's already being tweeted on social media, such as Twitter or X, um, and if it has a hashtag around it specifically, because hashtags are almost like footprints, digital footprints that people leave behind, and that becomes your collection marker. So if your conference has a marker, If you're part of a conference organizing committee, get a hashtag that everyone uses and promote it so you can study that data. And on my right is a very, very interesting study that we had done and was published in Frontiers, which looked at how during the pandemic, hashtag hospitals talk to loved ones was created. So our team, which included researchers, influencers, wanted to promote awareness that during the pandemic, loved ones of patients who have COVID-19 can get left out. And we wanted to promote a campaign around involving caregivers. So that campaign using this hashtag was very successful, and that became a study that was published. So what do people think about it? And people shared comments, people shared likes, comments, reposts. So you can imagine the kind of results you're going to see when you do kind of a campaign study. Now, the second kind of study is around polls, and I've written it as Twitter polls, but it applies just as much to Instagram polls or any other platform. So here you kind of identify a very trending, hot question that relates to healthcare, public health. Again, a strong component of influencer support is needed because that poll, it's almost like a limited survey that you're doing by using only one or two questions at max. And that poll can be designed in a very easy, user-friendly way, and it needs to be promoted enough to have enough responses. And because it's anonymous, and no one is essentially sharing their own personal demographic data other than what's publicly available on Twitter or social media, you don't have to get an ethical approval around it. So it's a very short and easy study design to construct, but again, it has to be popularized enough. And then you can write a whole paper around what people think around that cross-sectional poll that you just did. So that's the polling approach. And this is an example of a poll that we created with the help of our collaborators, and this was around vaccination. So simply asking people about whether they've been vaccinated and whether they would support the idea of mandatory vaccination. You can just see how poll one, poll two, very specific, short, concise questions, and then it's just circulated on social media. And imagine the number of countries you're going to cover by asking these two questions. And here it is, published in JMIR, Formative Research, where mandatory vaccination against COVID-19. It was a Twitter poll analysis on public health opinion. Another way to do it in terms of collecting research on social media is crowdsourcing. And I really like this approach because uh, practically speaking, I think, here as well, there is an involvement with influencers who can popularize you, but it's not mandatory. If you've got enough of an engagement going on with people, and as long as they can comment and your post is interactive enough to be commented on, that can be analyzed. So crowdsourcing is asking the public for their opinion around a critical challenge in healthcare. So a challenge around influenza every year annually, and you could ask it openly to all healthcare providers, and they freely comment in your post. And if they comment, if they share enough of their opinion as solutions, that could be an opinion paper, a bit qualitative, really, in the way it is analyzed. But these are themes because the comments are your results. So that's crowdsourcing ideas, opinions. And this is an example of a study we published on crowdsourcing. So how can we faster end the COVID-19 pandemic? And within a short timeline of 2 months, people commented, institutions also involved themselves in replying to that post on Twitter. And that was then written as a recommendations paper using this data. So that's crowdsourcing. On your right, you can see how the paper was again published in a very reputable journal. And on the left side, the recommendations that were created. So, personal measures recommended by Twitter users, lifestyle modifications, trust in experts. So, very, very fascinating ways of doing research using ideas from everyone else. And then here comes kind of our most, I think, researched, published way of doing research, which is hashtag analysis. And this is probably going to be the most non-influencer dependent way of doing it, whether if you're not someone who's as much of connected to influencers, this type of analysis relies on the power of the hashtag that is existing already. So if there is a hashtag around that's really famous, it could be turned into an observational or a longitudinal study in a retrospective nature. It is mainly for kind of topics and hashtags that have a community presence around it. And I think this is the most important thing I'd like to emphasize, uh, especially if you're looking at X platform and you're looking at analyzing a hashtag on X, you want to go for a community influence. So if it's, for example, Endo Twitter, which is the endocrinology Twitter community, or Peds Twitter, which is the pediatricians and everyone who use that, or a patient hashtag community. But community really is the heart of it. And you look into then analyzing the likes that this hashtag got, the comments, the types of users who are talking about it, and then the sentiment of people, whether it's positive or negative about this hashtag. There are different analysis tools that can help you. It's very quick to do that analysis if you have an expert who understands how to use the platform. And data collection isn't really a challenge at all here because it's all analyzed by a software. But one thing to note is the type of data that you get out of a hashtag analysis is quite restricted around understanding the type of people who are tweeting about it. It will not tell you people's opinions directly. It will not give you the chance to ask them questions. You're just observing a population that use the hashtag, and a lot of it is around social media metrics rather than people's healthcare opinions. So this is something that can be very much done in a short time frame. But the challenge can sometimes be analysis, finding a collaborator who knows how to use an analysis tool like Fedica, for example. This is an example of a paper that looked at hashtag psych Twitter as a hashtag analysis. And the same concept can apply to another research design, which is called video content analysis. So you could still use the hashtag, but on a platform where there is more video content going on. It doesn't have to be a hashtag for video content analysis. It can even be a keyword, but that can give you the top 100 videos on a specific topic. And then you can find the quality of information around that hashtag. So this is different from what we just talked about, where it was a community hashtag previously. So if you're thinking about community hashtag, think of X platform to understand the metrics of people. But if you want to understand misinformation or how good or bad is the quality of information around a certain disease, a certain treatment, so it's a specific thing, and you want to get people's quality of how they're sharing it. That's where video content analysis is really good because you're going to use certain scales that you can checklist and validate and get a score by watching videos. So it can be quite fun as well. You screen and you watch videos and you rate those scales using these validated tools. And then you write a paper about quality of information. So you see how with the change of platform and whether it's text-based like X or video-based like TikTok or YouTube, it's very different results that come out of it. It can be time consuming, at least when you compare it to something like an X platform analysis, because getting a community hashtag analyzed on X using software is very fast. But this is very manual because you're going to be watching those 100 videos using two reviewers and then rating them. So that's something to keep in mind. Here's an example of a study that's published by Dr. Kashyap and his team on a cross-sectional analysis of TikTok content around autism spectrum. So you can see how it's not a community, it's a disease, it's a treatment, it's a very fixed word. And there's a structure of doing it. So you can see there was an initial video search, then videos, some were included based on the criteria that you set, and then some were excluded. Maybe they were because of language restrictions or not related to the topic. And then they were grouped, they were assessed using raters. So reviewers will rate them, and then you can get a scale, rater A, rater B, and then get a quality of information about it and write a whole paper. And this is published in another very reputable journal um, in healthcare. So I hope that going through these research designs opened your minds about how many different ways you can slice a topic on social media. It could be the same topic that's done on TikTok and on X and on YouTube, and so many different ways that the data can look based on the platform choice and the way you did the study, whether it was using a hashtag analysis or a campaign. And I think that's where things get interesting. So special considerations, you're looking at the first point. So ethics board approval, a lot of the times, and this is a huge advantage for social media research, that you use de-identified data, right? There's no usernames that should be mentioned. There's no patient data that's being exposed here. It's all publicly available data. So you don't have to necessarily go through an ethics board approval. Of course, it depends case by case. You can't just generalize it, but a lot of the times it's not necessary. And social media ethics around research is still a very evolving topic. So it's not very in stone, set in stone in terms of how you would get an ethics approval for identifiable data. We also talked about how your choice of the social media platform can influence the results of a study. It's important to look into time that you may have in your hand before choosing a social media study. It can be a good thing, it can be a challenge. The number of people you have on the team, if you haven't got enough, probably I wouldn't look into a study that involves video content and reviewers. Journal choices as well. So some journals may still find this as a very foreign type of research. So you have to be prepared to be very clear in the way you're explaining your methodology in the paper, because for a lot of the editors and reviewers, this can be a new way of doing research, and they may not find it as acceptable traditionally. So we have to put an extra effort to explain how we did the study. But that also makes the studies even more rigorous, I think. So in summary, looking back at the topic of how data is the new oil, understand your strategy. Look at how much it will cause an impact, because um, a study like this is less about just making a trendy publication, but also influencing how public think about it. And a lot of the research is currently fixed inside clinical settings, and social media allows us to take it out there into the real world. And data is good if you know how to select your tools, your drill, and use that drill correctly, right? So whether that's for oil or social media, it's impactful if you know how to use it. So that kind of concludes this session. And if you've got more questions, reach out to us, and like, comment, subscribe to this video. Thank you.
Nawaz, that's fantastic. Every time I hear to this talk, it gives me new ideas and new perspective. Can you tell for our audience what is the biggest revelation for you since you started doing social media research? What has come out? Because some of the strategies or some of the types of projects you share with us, you can practically cannot do it with the traditional research methodology. So can you share any biggest uh, pleasing moments or anything which has come out in last 4 or 5 years for you, given that you've been one of the pioneer in social media research?
Yeah, thank you. I think for social media research, the because the advantage has is the speed at which how you can bring from idea to output. I think that's been my biggest uh, way of looking at success, because we've managed to allow research to come out, and that's one of the challenges in the very kind of traditional, which is also very evidence-based research methods, but they can take time for translation of that evidence. But with social media research, we can get the public's opinion in a way that can directly get to policymakers, public health. So I've had the pleasure of being able to sit with a broader audience to talk about the outcomes of social media, and then connect with such a global audience, because often collaborators are very interested to use this data and influence, and also study their own impact, because social media influencers don't get to see the results of their influence, including healthcare professionals. So this is very empowering both as a clinician, but also as a researcher at the same time. So this is the peak, I think, of what a researcher and a doctor would want, to see their impact come out there in the real world.
Very well said. Thank you so much for presenting today and answering our questions. I think we need to bring you back and record it every 6 months or a year, and then you can share newer projects which get published in this time. Thank you for watching. Those who are listening, and like and subscribe our channel.